Okay, so I just reconfirmed something. So atropine in the heart, in the cardiovascular system, has a couple of effects. One, and let me pull out my diagram of these cholinergic neurons. Okay, so at the end bulb of the neuron, remember there's a receptor right here, which is a turn-off receptor. It's a feedback receptor that tells the nerve to stop secreting so much acetylcholine. When this gets stimulated, it kind of makes this guy stop releasing acetylcholine. At low doses, atropine bonds very nicely with this receptor and blocks it, stops it from doing its job. So, at low doses, atropine actually allows more acetylcholine to be released in the vagus nerve, which results in a lowering of heart rate. That's what the vagus does. It dampens the heart rate. So at low doses, atropine creates low heart rate. At high doses, atropine stimulates other muscarinic receptors in the heart, in the sinoatrial node, which allows, or actually blocks them. The sinoatrial node keeps a very slow, steady heartbeat. It's supposed to let a certain amount of impulse build up, and then it fires. Well, at high doses, atropine blocks this certain type of muscarinic sub-2 receptor in the sinoatrial node and allows it to actually fire more frequently. So at high doses, higher heart rate. Okay? That's pretty easy. That's the divergent or duplex effect in cardiovascular. So, in the heart, low dose, low heart rate, high dose, high heart rate. Good. I forgot one that should have gone next to gut, and that is urinary. Let's just put bladder, shall we? The muscarinic receptors usually stimulate the muscle that empties the bladder, and there's a lot of people who do that too much. So atropine is a very effective bonder to prevent the stimulation of that emptying muscle. So it can be used to reduce urination. It can be used to improve urinary retention. So atropine reduces urination. Okay. Lastly, I told you that muscarinic receptors also are present in sweat glands and in saliva. So atropine can also reduce sweat, saliva. Okay, so that's all of the jobs of atropine. And it's actually used for all those things. Oh, one last thing that it is also, it's an antidote for some agonists. There are some agonists that we remember, edrophonium, visostigmine, neostigmine. Things like that are actually weak versions of some chemicals that could be called nerve gas. Atropine is an antidote for that. In enough, you've got to give a lot, but it can help reduce the effect of those agonist drugs that can cause paralysis and damage in the system. So it's a antidote. Again, we're not going to put that, but all right, so these are all the things. Let me just see if I've kind of over-identified. What kind of uses are we talking about? Therapeutic uses? Yep, it's used as a strong dilator. It's used to reduce motility in the GI tract, and it's also sometimes used in surgery to reduce secretions like that. Okay, so that's atropine. Let's see if we can squeeze some other antimuscarinics in here with quick descriptions. And this, I guess you could memorize that. So the next group the next drugs are going to be the guys that are related to atropine in that they are other ophthalmic drugs. First one, scopolamine. No, actually, let's go cyclopentolate and tropicamide because they're very, very simple. Cyclopentolate and tropicamide, both of which we've seen. Really, these guys just have a type of muscarinic receptor shape. Hold that thought.
Say something. Yes, suspect.
Had to close the window.
This time.
Oh, fuck.
That shit you tried to pull today, that'll be working.
Okay, had to close the window. All right, cyclopentolate and tropicamide really just have muscarinic blocking activity on very specific receptors in the eye. They're just used topically in ophthalmics. So cyclopentolate is a dilator and cycloplegic. So we're going to call it out with a blue pen. Cycloplege. And I think we're usually talking, I usually say it won't last more than 8 hours. Let's see what the book says. Well, okay, this guy, I'm saying that I'll say somewhere between 8 and 24 hours of cycloplegia. The book says up to 24. Tropicamide, it is not really a cycloplegic, it is a midriatic, meaning it's supposed to just affect the pupil, not really supposed to have much cycloplegic effect. I know it kind of does, but let's think of it in terms of, if you have a painful ciliary body, are you going to give tropicamide to relax that ciliary body? No. At the weakest, you'd give cyclo. You're probably going to want to give homatropine, scopolamine, something like that. But according to these guys, the midriatic can last up to about, what do they say, 6 hours. I usually think it starts wearing off in 3, but let's say 6 hours. Okay. So far we've got muscarinics. These are all ophthalmics in the eye. And atropine has a few other uses. Now, scopolamine, that's another one, kind of similar to atropine in that it penetrates the central nervous system, but it's also used as an ophthalmic too, damn it. This guy is more generally appearing, it's a plant alkaloid. Again, it comes from some plant, and so it penetrates the central nervous system, and some of its uses are for the central nervous system. Kind of cool. Of course, it's a midriatic. It is a strong cycloplegic, and as a result, you can use it for some really crazy relief of, a ciliary spasm. So we can say strong cycloplegic. I'll say it can go up to probably 2 to 3 days, I would say. But the other thing scopolamine is used for is it penetrates the central nervous system. It has a couple of effects. It can create, let me just double check to make sure I'm not going to give you the wrong information. Yeah, it has about 2 uses, both of which occur either in the brainstem or the brain. The first one is that it's probably one of the most effective motion sickness drugs. It's usually in a patch, you put it behind the ear, and it's very good at preventing seasickness. Not very good at stopping it once it's started, but it's very good at preventing it. So, let's say motion sickness. Well, you got the ice cream truck in the background. One thing, by the way, if a patient comes in and they have one pupil that's kind of dilated and kind of accommodative, it's not accommodating, and you try to find if there's an APD, if there's a conduction deficit, and there isn't, I would always ask them if they had used scopolamine or been around insecticides or something, because very frequently it's either the scopolamine patch that is diffused and caused dilation and cycloplegia in the ipsilateral eye, or sometimes yard materials with insecticides, they can touch themselves and that'll happen too. Anyway, scopolamine will dilate the same side eye sometimes, but it's great for motion sickness. The other use it has is primarily in surgery. It can cause short-term memory loss, and sometimes that's important for surgeons. So it's going to be effective for short-term memory. It creates amnesia, and I guess that reduces, if you have to have a patient awake during a surgical procedure, you don't want them remembering it. Back in World War II, they actually used it as a truth serum, which is interesting. Okay, moving on then, we've got all of these guys, scopolamines, tropicamide, cyclopentolate. We've got 2 left, and these guys have kind of very specific uses. First, let's talk about ipratropium. You write that in black pen. And it's really just got one use. This guy happens to fit the receptors in the mucous membranes in the bronchial tissues. And as a blocker, it reduces the cholinergic impulse to secrete, right? Remember, that's actually a sympathetic tissue, but it uses acetylcholine. So this guy will dry out, just like kind of atropine can do it. Sometimes in surgical environments, they'll use atropine to dry out saliva or to dry out secretions. Well, this guy is used kind of as an ongoing asthma and COPD. So we'll say dries bronchioles for asthma and COPD. Okay, that's what that drug does. And last but not least is tolterodine. And that has a specific use too. Just like atropine that has a bunch of them, ipratropium happens to affect this receptor. Tolterodine affects the bladder receptor. And that's a very often used drug. You'll see it during football games, commercials for it. I think it's Detrol, and it's used for urinary incontinence. You see it for older guys and stuff like that. So, tolterodine. And it's just for bladder. For incontinence. I don't even know if I'm supposed to, is that an E or an A? Incontinence, incontinence? Doesn't look right. Let's try E. Yeah, that looks better. Okay, well, this probably would be the upper part of your poster. If you can write this, with a small Sharpie, you could have this taken up about the upper half, let's say, of the page. And hopefully those little clues will help you remember. Some things that you don't need written down, you just remember in general, is that these muscarinics really affect certain tissues because of the specificity of the receptor, right? They all block certain types of muscarinic receptors, some fewer than others. So we can just remember, use some kind of mnemonic to remember these guys. This is what they do. All right, so that's antimuscarinics. Next, we're going to quickly go through the ganglionic blockers.